Okay, I'm going to scan the room and then you can start. All right, here you go.
Hi, my name is Casey Blake. Today I'm going to be doing a postpartum assessment. First, I'm going to start out with my 13 safety practices. 1, I'm going to verify the order. 2, I'm going to perform hand hygiene. 3, I'm going to verify the facility's policies. 4, I'm going to consult the manufacturer's instruction on the equipment that's required. 5, I'm going to knock before entering the room. 6, I'm going to ID the patient using 2 identifiers. 7, I'm going to note the patient's overall condition. 8, I'm going to explain my procedure, provide for privacy. 9, I'm going to elevate the bed for good body mechanics. 10, I'm going to don PPE if necessary, or if needed, which I do have some gloves behind me. Don PPE. I'm going to, upon completion of this skill, I'm going to lower the bed, put the side rails according to the order. I'm going to place the call light within the patient's reach. 12, I'm going to report any abnormal findings. And tell the nurse or the charge nurse or doctor. I am going to, 13 is I don't do an IV push without my instructor present. So today we are going to be doing the postpartum exam. So I would knock before entering the room. I would tell the patient my name. I would ask the patient to go to the bathroom before and to perform pericare, put on a clean pad, and leave her old pad in there for me to inspect as well. And then I would come back within about 15 minutes and we would start our exam. So first, I am going to examine her breast. I need to know if she's a lactating mom or if she's not lactating. If she's not lactating, I would not palpate her breast because you don't want to stimulate the breast in any way. I would teach the patient that if she's not lactating, to use a tight sports bra or to use cold compresses. If she is breastfeeding, I'm going to palpate. So what I'm looking for on her breast are I'm looking for any cracking. I'm going to note what type of nipple it is. So if it's everted, flat, or inverted, I'm going to note the skin around it. I'm looking for symmetry when I'm palpating. I'm noting the temperature as well. And with a lactating mom, some things to help would be to feed the baby often. It would be to take warm showers. Warm compresses help to alleviate any, to help with nursing. And so next we're going to move on to her uterus. So when we're doing this, we want to support her uterus, and we are going to palpate the fundus to see where we're at. So she has a firm fundus, and it is, I guess I could take down her little panties real quick. So again, we want to support and we want to feel our uterus or our fundus, and she has a firm fundus. It appears to be midline. It is 2 finger breadths below the umbilical, and she is 2 days post-op, so it does correlate with our findings. She's firm, midline, and 2 days post-op, yes. Okay. I am also going to, if she were not firm right here, we would want to massage her fundus if it was like boggy, and to try to expel any placental fragments or anything to try and firm it up. So next we are going to note any distension of the bladder and distension of the bowel. We would ask when her last bowel movement was. If she's having any trouble with bowel movements, we would teach her to increase fluids. We would teach her to intake more fiber, and ambulating helps as well. So we will listen to our bowel sounds. Okay. All right. So once we've noted that, or we've looked and checked for any distension of the abdomen, asked the patient about any pain associated with bowel movements and everything. Oh, stool softeners also will help to move things along. So next we're going to check the lochia, and we are going to remove her pant. I'm going to help her take off her panties. And so with the lochia, so she's 2 days post-op, so we want to see the bright red rubia. So we are going to remove the pad. We're going to take it down. So it's bright red. It's a scant amount, which is normal because we did ask her to perform pericare before on the pad. So while there's no unusual odor either, I am going to have her ask her to roll over, and I am going to check to see if she has an episiotomy and any hemorrhoids. I'm also looking to make sure there's no like blood pooling or anything. So we're going to check, and she does have an episiotomy. There's no signs of redness or ecchymosis or edema, no swelling. There's no abnormal drainage or discharge, and it looks like her edges are healing. They're approximated. She does have 2 hemorrhoids, and with the hemorrhoids, we can teach her to use witch hazel, the Tux pads, or we can also teach her to use the sitz baths as well. So I'm gonna roll her back over. Again, with the hemorrhoids, she may be afraid to have her first bowel movement, so the stool softeners can really help. So when we put on a new pad for our patient, we want to do front to back, as well as when we take off the pad, we do front to back, always front to back. So we would do that. I'm also going to assist her with putting her panties back on. So next we're going to check our extremities, our lower extremities, for any just signs of blood clots, or just make sure everything is getting perfused correctly, nicely. Okay, so on our mannequin over here, we are going to, again, we're just going to check her lower extremities. We're going to make sure we have bilaterally present pulses. We're also going to assess our temperature on our patient bilaterally. So we just want to feel. We're going to ask if there's any pain or any abnormal like heat, especially around like the calves area, the popliteal. We also want to check our pulses bilaterally, and just to make sure they're equal in strength and that they are present, and they are. We would also take this time to ask our patient how she is feeling with the pregnancy, if she's in any pain in any area, to please describe. We also want her to elaborate on how she's feeling about her baby. Just, are you having any problem, or how are you feeling about your baby? We would want to observe how she interacts with her child, make sure she's getting enough face-to-face contact with her baby. Upon completion of this skill, we would lower our bed, raise our side rails according to the policy, according to our order, and we want to make sure our colight is in reach. We would document our findings and go on about our day.